and really for the panelists to kind of cut across different silos. I mean, we've talked a bit about the role of policy in all of this. It's an important piece, especially when we think about medicine. We end up hitting roadblocks, whether it is regulations, whether it is distribution, whether it is advertising, marketing, things like that. And thank you, Lisa, for talking about all that was possible from that perspective, and then going on to what Dr. Harris was able to shed some light in terms of the journey in technology, going from science fiction and some of the trends that are I think we're living through right now, and bringing it together in a machine learning and a data science evidence perspective. But I just wanted to talk for a few minutes about what we do, because we started out, we've been at this almost over 4 years, coming up to 5 years now. And our intuition at the time was to be able to create a consumer grade experience. And one of the things about consumer grade experiences, as we all know, we're all consumers of technology. And I guess we have a certain expectation and a standard in terms of what we will expect in a user experience, in a flow, in an engagement, in a polish, in a sophistication. And on top of that, when you layer in kind of the realities of what is required to work in the field of medicine, where eventually you're going to be asked the hard questions about what is the evidence? Does this really work? And then that conflicts almost directly with the rapid pace of iteration that is required when you're trying to create consumer-grade technology. So we took this upon ourselves. We started out with this broad mission to try and impact the nutritional choices of children, based on a very simple idea. The idea that our food eventually plays a big role in determining our health. A simple idea that I think is a wisdom that cuts across the world. It's almost goes back. You can trace it to ancient roots in terms of the role of food as medicine and the role of food in profound ways beyond just our physical condition, but going on to our environmental condition as well as our mental condition. But it really began when I think I had a bit of an epiphany, if you will, when I became a father for the first time, because that motivated me to kind of appreciate the world from the eyes of my daughter, who was barely a year old and was able to kind of use my iPhone, which was a pacifier, and get to watch her cartoons. And it was very obvious that the media was already influencing her preferences, her choices, and her entire evolving habits around food. So this was something that she was responding to in a very visceral and instinctive way. Even before she could speak a word, she recognized her favorite characters, who would then go on to endorse products that we would find in the grocery store as we were walking down the aisle. And before you know it, it became clear to me that her associations, her preferences, her choices, what she was asking for, was kind of being formulated at that very young age. And then I was able to kind of think about this emerging trend where technology is now, consumer grade technology is now finding its way in the hands of kids at younger and younger points in their lives. So there's data to show that the first time a child gets, or a human being gets access to a smartphone is now almost as young as 2 years old, at least in the United States. And that's a trend that was going to kind of sweep the world. So we felt that we had to be relevant to it. But what we had to do was to use, I come from a gaming background, a simulation background. That's where I cut my teeth as a founder. In fact, I ran a company in the VR space before VR is what it is today, but mostly PC-based. But now it was very obvious to us that that VR and the power of simulations could have profound impact on influencing these perceptions and leaving these very indelible imprints in their minds at a point where their understanding about what is food and what the positive association with food may end up being for the rest of their lives. So we used a lot of science, and we kind of went back to this because we've been mission oriented. It meant a lot to us. It was in our DNA to try and determine evidence. So from the very beginning, the question was, okay, we can do this potentially theoretically, but if we do, are we actually going to move the needle in the right direction? So that was a question that we had. We dug deep into neuropsychology, and we worked with some eminent neuroscientists to really understand what is happening in children's minds and what kind of approach may possibly begin to trigger those parts of their minds that may achieve what it is we're trying to do. So with that, we kind of evolved a framework of VR-based mobile gaming, and using a lot of psychology, using a lot of personalization, and essentially driving what feels like entertainment to them, we're able to almost subliminally influence their perceptions. But we've almost chanced upon a new way of looking at design, because I think everybody is familiar with what gamification means, where it's usually and that in some ways as a game designer or as a designer, you always think about the motivations that you want for your users to be able to plow through what it is you want them to do. So there are usually intrinsic motivations and extrinsic motivations. But from the world of healthcare, as I was kind of immersing myself into medicine and behavioral medicine and healthcare as an outsider, as just an engineer, it was clear that that there are a lot of things that we want people to do in favor of their own health is sometimes forcing them to climb uphill. So it was about reducing that friction, reducing the kind of the steps required even to onboard, to progress, and think about it in a very in a design-oriented way. And we came upon an idea or a concept of learnification, which is really all about taking core gaming ideas or game mechanics and embedding learning that is very relevant to that context. So we created Fuya and took it to another step, which is to make sure that it was actually relevant to the medical world and to the world of medicine, and put it through a number of clinical trials. So the result of this trial was done at, the trial itself was done at Baylor College of Medicine at their Children's Nutrition Research Center, and it was published then at Obesity Week. And since then, extensions of this have been kind of published at Childhood Obesity Conference, so on and so forth. But the whole idea that we can now put entertainment in the hands of kids and actually watch in a very randomized, controlled way, see how their preferences are being modified. And not only are they being modified, now we can stick with them through retention and engagement mechanics as part of the consumer experience that we deliver. And now we're able to kind of shift their habits or cultivate habits based on behavior theory. It's well understood that if we are able to change or modify behavior for almost 30 days, then there's a good chance that it actually turns into a habit. And there's more theory that points us in the direction of the fact that if you're able to modify or inculcate these habits early in life, there's a good chance that it will stick with them for the rest of their lives. So a lot of this was validated by kind of statistically significant outcomes that we were able to see in favor of unprocessed food, and as well as far as water and sugary beverages is concerned. But we've been able to do it kind of in partnership with some great people that have kind of gravitated to it, and we still have a long way to go in terms of our journey. But I wanted to kind of just leave you with this in terms of our approach to kind of creating medicine through entertainment. And our vision is to kind of extend it beyond just a mobile experience, but perhaps someday we'll build theme parks that kind of get people in and turn them around to be a little more healthy in some measurable, quantifiable way. So we've got some data as far as how we've performed. Most of our ongoing work is really focused on collecting and broadening and deepening the evidence base. We're doing this global intervention now with Johns Hopkins through their Bloomberg School, and so it's for the very first time we're able to take the product and scale it beyond a US focused kind of an application that we have been so far. Because one of the things that motivates me and I'm very passionate about is the fact that this is a global problem. And in many ways, what we invented here is sweeping the world. So the whole idea is that through Fuya and through a platform, we're able to not only use children as an entry point into families, and then possibly in the future create a social experience through which entire families are able to become more healthy as a result of healthier lifestyles, and doing that in a very evidence-backed way. So with that, I'm going to stop boring you with what it is we do, but I would love to kind of have a bit of a conversation, and I'd leave a few minutes at the end for any kind of questions from the audience. But my first question really was to try and have Rema Padman, uh, where to talk about some of uh, uh, the evidence-backed approach. I think you already talked about that, Emma. How do you see like evidence-driven and research-backed work, especially in the context of this tension between this rapid iteration that is required to produce relevant consumer-grade experiences? So how do you think, given your background in data and data science and evidence, how do you think those two things have to be reconciled?
Um, so we know that, on the one hand, just thinking about mobile apps alone, the latest, I think, numbers say there are more than 100,000 mHealth apps out there. And as a consumer, as a layperson, when I go look at them, my question is, what evidence is there that these work? And how can I really trust this information that we're seeing out there? Um, yeah, so there has to be, just like we're talking about that we need to have these consumer reports on healthcare. There has to be a mechanism by which consumers can really find the evidence and then utilize that easily, and then you be able to utilize it. So I think it's almost a must, a requirement that should be tied to these innovations and consumerizations and putting out technologies out there that we do have that evidence coming out of these developments. And so just from my experience, the example that I was giving about that startup on diet on nutrition management, that they have found this way to tie into food pantries to provide new kinds of services to the food insecure population. Well, there I find that perhaps there are three different components that we need to think about in generating that type of evidence and in this fast cycle loop. One is that, having the technology is just one piece of it. But sometimes you find that the technology doesn't exist in a vacuum. It has to exist in a context. And so that context, if you don't have services where this technology can be easily deployed, then the technology has very little value and doesn't really, generate the value that you would expect it to. So then combining technology plus services. But then in order to provide a service, embed the technology in a service, you need to have the economics associated with it, you need to have the sustainability associated with it, and you need to have the policy considerations. So the technologies are advancing very quickly, but perhaps the confidentiality, the privacy, the ethics, the access component. So this particular population, for example, when they talked to the food pantries, they said we can make our technology available. It should be very easy. They found that they couldn't find independent dietitians who could be they could partner with in order to talk to the customers coming to the food pantry. Dietitians are mostly associated with either grocery stores, hospitals, and so on. And then the other challenge they found was they couldn't get access. The consumers half had, the 50% had smart phones, but the remaining 50% did not. And if even those who did not want to give up their data, the storage and so on, to download yet another app. And so they moved to SMS for those for that. So adaptive, closed loop evaluation, that is, you learn on the go and in an iterative manner to be able to provide the right services targeted to the right consumers. I think that's almost a requirement.
That's totally fascinating that you say that, because in some ways, I think when you're creating consumer grade success stories, the scalability of an approach, and sometimes, in being able to match a dietitian to a patient at the real time, at the right time, is always kind of a challenge, especially to find qualified dietitians to meet the requirement. But one of the challenges, I think, from an evidence perspective, even for a startup or for any company thinking about medical technology seriously, would be kind of getting protocols developed with researchers and getting kind of review boards to approve those protocols. But perhaps, Dr. Harris, you can kind of give us some, what you think about that. I'm kind of going off of a different question, but did you have any thoughts about what the standard of clinical trials is, and how that may kind of affect the way consumerization of technology may actually evolve?
So before I answer that question, let me complete a little bit of my story. I talked a lot about NASA and also that leading into telemedicine. But what I didn't tell you is that I currently run a venture capital firm focused in telemedicine. So since 2002, we've been investing in the healthcare space, in this space. So to your question, when we get companies that come to us and they come either with a product, and then this really pertains to product, but we look at products and services, but come to us with a product, and I'll use an example. We're working with a company now that has an app, and what the app does, it's a new form of apps called companion apps. And as Rana just mentioned, there are over 150,000 medical apps that are out there, but only about 20 of them are FDA approved, meaning that they have to go through the IRB and prove their effectiveness for the FDA. I think this is going to be a trend going forward. I think in order to really figure out the wheat from the chaff, you've got to have these trials. You've got to have these protocols that prove the effectiveness of it. And so there's going to be a shakeout there. From an investment standpoint, we're probably only going to look at those apps and those technologies that have a proven clinical effectiveness.
Well, no, for sure. I think that, certainly is a pain point as kind of even innovation happens in this space, so that it truly does do, and there is a standard, there's a bar that is set that allows for innovation happen such that it is evidence-backed, given that it is going to affect lives. But, Rema also touched upon something in terms of policy, Lisa, so this gets to another question that I had in mind to direct to you. And given all your work in the world of policy and dealing with regulations and being in the food industry, and how do you see, I guess, innovation happen given so many case studies of companies that have gotten too far ahead of themselves, or maybe brazenly, or as in a rebellious way, or perhaps just because they didn't understand the regulatory requirements of dealing in this space. And we would love to hear your thoughts about how innovation meets regulations.
Yeah, I think one thing, and it's been brought forward many times, we were successful with healthy weight because we had 16 of the largest companies in the world. Now, what was interesting about that is we were actually being forced into regulation related to the amount of fats and sugars within the food. And what we came back with and what we negotiated too is that when we talked about a broad array of companies that had, peanut butter and ice cream and bread and cheese and sodas, that it was very difficult to regulate what the changes would be. And so we actually instead asked for an agreement that we would compete on calories. And I think one of the issues, and as a result, we were far more successful, right? Because everybody could run to the finish line, making changes in the manner that best fit their product portfolio. One of the challenges that we have anywhere in the world of innovation in a highly litigious arena, which is what we are in right now, is whether it's food security, or medical technologies, is, it's a primary conversation today that, from Volkswagen to the recent phenomena here in Silicon Valley with the blood testing company, is that you have to stick with the regulations. The issue is that you also need to come up with creative ways that you can meet within the context of the regulation in order to affect change. Secondarily, transparency, no matter which arena you're in, is highly critical. We actually were very successful because we went to the Robert Wood Johnson Foundation, which was not a fan of the food and beverage companies, and we were highly transparent in the manner in which we were making the changes. We got the White House and the government to endorse the self-regulatory process because of the level of transparency that we had. This is how we're going to make the changes. We're going to compete on these changes. We brought the lawyers into the room so that we wouldn't be accused of collusion. Instead, it would be seen as a collaborative competition. But we took a number of different steps, and we invested the money to ensure there was a level of transparency and accountability and accounting. We did two dual accounting processes through this, and so that when we came forward with the results, they were in fact true results, and secondarily is we had them validated by a number of different individuals, both within the White House, OMB, and the Robert Wood Johnson Foundation and other foundations. So I think the thing with regulation is I personally would like to see less regulation. I do think it inhibits innovation. I think it's important, though, if you're going to attempt to remove yourself from a regulatory process, is you do need to establish a very transparent process that is done in conjunction with outside parties that are trusted by governments around the world, so that when you come up with the results in your self-regulatory arena, they are trusted and you are seen as having complied with all the regulations that affect your industry.
No, that's fantastic. I mean, it's a very real thing, and I think over time, even we've from a Silicon Valley perspective grown to kind of respect, I guess, the regulatory kind of process, even though it's all about a can do and can break the rules sometimes. But so, when lives are at stake, and what the outcomes are really making an impact on real lives, that's a whole other thing. But I mean, we could keep talking like this forever, because I think we've got such a range of expertise, and the conversation can go on for a long time. But I would love to see if there was any kind of comments or suggestions or feedback or even questions directed at anybody on the panel, or anything from the audience. Yes, it is close to lunchtime, so I know, I totally understand. But yeah, go ahead.
There was. We were actually allowed, the agreement on our self-regulatory process is we could change the recipe of existing products, we could introduce new products into the marketplace, or we could create portion-controlled products. And I think one of the biggest surprises to everyone, including the beverage companies, is the small cans of soda have actually been amazingly successful. They were kind of thrown out as a novelty, but they've been amazingly successful in reducing consumption of sugar-based products or high-calorie products.
No, it's absolutely a great point. Now, I'll let you respond to that.
Yeah, I mean, I don't have the answer, but I can tell you it's kind of interesting to see products that didn't do FDA approvals. I'll use the example Fitbit for now. So Fitbit came out, and the whole focus was on the look and feel, and it was cool and all that sort of thing. But if you follow their product development, they're moving toward healthcare, right? So they're adding not only pulse, but now they're looking at ECG, and they're looking at sweat content, hydration for performance. And so there's this convergence that's going to occur, from the consumer side going more toward the medical. And then there are medical devices, or medical apps that are moving, trying to figure out how can we get more eyeballs. That's the issue that we have with this company. How do you get, take something that's been proven to work, and how do you get consumers interested in it? And it's somewhere in between. And I don't know what the answer is going to be there. Yeah, how do you close the gap? That's a good way of putting it.
The FDA, from our understanding of where the FDA stands in terms of mobile apps, is at least they've taken a position that they're not going to regulate mobile apps so long as they're not a diagnostic tool or a disease management tool. So mobile apps, I guess, that are kind of getting ahead of the regulatory framework, or either knowingly or unknowingly, are doing so only because they don't feel like they're not in that domain. I think the minute you get kind of vociferous about your advertising and the claims and the benefits associated with it, then you're likely to come on the FDA's radar and they will go after you. Or if it's not the FDA, it's the FTC. It's one way or the other. They're going to take a close look at this. So it's certainly a very interesting space, and I think now with I think a growing fascination even in Silicon Valley with some of the biggest giants in technology looking at this space more closely and more intently. Perhaps it's a way for kind of the regulatory approach to this also to kind of evolve in some ways. So
I'm going to share one of the companies that we are working with in the app arena is a new company that's based in France called Volunas. And what they have is a new category app called companion apps. And these companion apps are actually FDA-approved applications that are bundled with drugs. And their first market is diabetes. So they've gone to the insulin manufacturers and say, okay, if you allow us to, know as much as we can about your drug and package it with your drug, we're going to increase your utilization. We're going to provide you better outcomes, patient outcomes, and because it's FDA approved, you're going to get paid for the app. So it answers that question about how do you generate revenue. But again, that has to be FDA approved. But I think you're going to see a lot more of these apps come to fruition, come to market.
Yeah, and even when there is a reimbursement model in place, as I talked about this nutrition therapy management, there is a very well established reimbursement model in place, but you need to get all the players together. You need to have the technology, you need to design the service, you need to deploy them, you need to reach out to the appropriate consumers, and you need to have the clinicians available and joining the team. So it is not just the the app and there's a market existing for it. It's really a lot of different. Right.
true.
Right.
It's so true. So many stakeholders in health, and I think this conference itself represents even in a wider spectrum of people who are stakeholders in health, and so it's certainly a complex platform, but I think sometimes simple solutions that can cut through the noise in the consumer space have been shown to win. So it's going to be a very interesting kind of thing to be a participant in, but also to kind of observe how things go. So I think we're running into lunch now, so I'd love to wrap up and thank my panelists for being here in the audience, and really appreciate your participation and questions. And they'll be around, so if there's any questions, please feel free to come by. Thanks again.